Do you ever notice that a child seems to grow taller faster than their peers, or that they get a deeper voice earlier? These clues can point to a hidden hormonal problem called congenital adrenal hyperplasia, specifically the most common form, 21-hydroxylase deficiency. Imagine the adrenal glands as tiny factories that make two important products. Cortisol helps you cope with stress, and aldosterone keeps your salt balance. In 21-hydroxylase deficiency AH, the factory's main machine is broken, so the body cannot make enough cortisol or aldosterone and tries to compensate by overproducing other hormones, leading to the symptoms you might have observed. Let us explore how this happens and what can be done. The cause of 21-hydroxylase deficiency is a change mutation in the CYP2A2 gene that gives the adrenal gland its 21-hydroxylase enzyme. Think of the gene as a recipe. A typo in the recipe means the enzyme is missing or does not work well. The condition is inherited in an autosomal recessive way. Both parents must carry one faulty copy. If two carriers have a child, there is a 25% chance the child will have CAH. Most families discover the mutation only after a newborn shows signs, but carrier testing is available for relatives who want to know their risk. Because the adrenal factory can't make enough cortisol and aldosterone, the body reacts in three main ways. Salt-wasting crisis. Low aldosterone leads to loss of sodium and water, causing dehydration, low blood pressure, and sometimes vomiting. A toddler who suddenly looks very thirsty, cries a lot, and has a low-grade fever might actually be having a salt-wasting episode. Excess androgen production. The body shunts building blocks into male hormones. This can cause girls to have enlarged clitoris, facial hair, or early puberty. Boys to grow taller quickly and develop facial hair early. Low cortisol makes it hard to handle stress, illness, surgery. A child may become unusually sleepy or have low blood sugar during a fever. These signs often appear in the first weeks of life, salt wasting, or later in childhood, androgen effects. Doctors start with a simple blood test, measure 17-hydroxyprogesterone, 17-OHP in CAH. This level is much higher than normal. If the result is unclear, a cortisol stimulation test or genetic testing of the CYP21A2 gene helps confirm the diagnosis. Treatment is lifelong but straightforward. Glucocorticoids, for example hydrocortisone, replace missing cortisol and suppress excess androgen production. Think of them as the missing supervisor that tells the adrenal factory to slow down the extra hormone production. Mineralocorticoids, for example fludrocortisone, replace aldosterone when the salt-wasting form is present, helping keep sodium and blood pressure stable. Salt tablets and adequate fluid intake are added for babies during illness. Parents learn to adjust medication doses during stress, fever, injury, a sick day rule where you give an extra dose of hydrocortisone. Regular follow-ups with a pediatric endocrinologist ensure growth, bone health, and hormone levels stay on track. Because CAH is genetic, the best prevention is knowing the risk before a baby is born. Couples who are both carriers can consider carrier screening, a simple blood test to see if you carry a CYP21A2 mutation. Prenatal testing, chorionic villus sampling or amniocentesis can detect the mutation early in pregnancy. Pre-implantation genetic diagnosis, PGD. For families using IVF, embryos without the mutation can be selected. Even without these steps, early newborn screening programs, many countries test for 17-OHP in heel prick samples, catch most cases before severe symptoms develop, essentially preventing crises. While you cannot change the genes you inherit, being aware and testing early lets you act quickly to avoid life-threatening episodes. Improved newborn screening algorithms that reduce false positives and catch milder forms of CAH. long-acting glucocorticoid formulations, for example, modified release hydrocortisone, that better mimic the body's natural cortisol rhythm, improving growth and quality of life. Gene editing trials, CRISPR-Cas9, in animal models show promise for correcting the CYP2A2 mutation at its source. Still experimental, but a glimpse of a future cure. Digital health apps that remind families of sick day dosing and allow real-time hormone level tracking, making management more interactive and safe. These developments aim to make treatment smoother, reduce side effects, and eventually replace daily medication with a one-time genetic fix.